A very good evening to all, and welcome to a brand new episode of E-Confab 3 Icons of Inspiration, a step towards better future. So, we are here again today with another interesting talk show on the topic Teaching in a Medical School in COVID era Challenges. But before introducing to our guest today, let us throw some light on the news bulletin Times of MGM presented by S. Harikrishnan of Class 7G.
Hello everyone, welcome to one and all. News for the day are as follows. Now some international news. Air India gets required in UK court over aircraft loan payments. Israel embassy partners with NGO to help underprivileged in India. Now some national news. Starting with the positive notes, economic indicators show encouraging signs of recovery. Compared to February, when pandemic started, things have changed in December with the progressive positive note. India's active COVID-19 continue to decline to follow a steady dipping path. Talks are still going on between government and farmer to solve issues on the demand of farmers. Now some local news. Chief Minister Shri Bhupesh Baghel said that 100 new Swami Atmanand English medium schools will be opened across the state. Around 14 small and medium level shopkeepers of different levels of Risali Municipal Corporation got loan under Prime Minister flagship scheme in the name of the National Urban Livelihood Scheme. Now some sports news. Junior Athletic Championship in the progress of Kota Stadium, Raipur from December 11 to 13 December. Veteran Indian cricketer Sunil Gavaskar said due to the survey of lockdown, players are unable to go out or train themselves. But still Indian bowlers can fight fire with fire. Now our MGM news. Mar Glorious Memorial has initiated to develop communication skill for pre-primary children under the guidance of our Mrs. Anita Chaudhary ma'am. Thank you. Have a nice day.
Not all angels have wings, but some have stethoscope. This is a beautiful quote which is enough to tell us about the theme of today's program. We all know that medicine is a science of uncertainty and an art of probability. Our today's resource person belongs to this field only, who is presently working as the program director for MBBS program in School of Medicine, Taylor's University, Malaysia, Dr. Shajan Koshy, who has completed his schooling from MGM Senior Secondary School Bhilai 1981 batch, after which Sir has pursued MBBS at Gandhi Medical College Bhopal. Dr. Sajan has been working as a reader in the Department of Anatomy Christian Medical College Vellore till 2007, then moved to Malaysia. Sir has also various research papers and publications. We extend our heartiest welcome to you, sir, and we are glad that amidst your busy schedule you have joined us today. Welcome back to MGM, sir.
Good evening. Thank you all for inviting me to this talk.
It's our pleasure, sir. Sir, as we all know that this COVID-19 era has taught all of us to clearly distinguish between our real life heroes and real life heroes. And presently, most of us are assured that all the medical staffs, doctors, and the forefront workers who have continuously assisted us in these crucial times are our only heroes. but they have faced a lot of difficulties and challenges also. Sir, we would like to hear from you a little bit that how you have emerged out of these challenges professionally as well as personally. Please, sir.
Thank you for the beautiful question. As a doctor, when I heard about initially about COVID-19, I found that it was just a respiratory infection, and so we don't have to worry much. It was in the month of December 2019. When I used to read all those news from different parts of the world, especially China, I thought it was confined to China. But when it started spreading, and on March 18th, when we were told that our university is going to be closed for all face-to-face classes, the challenges which I have to take for my students in teaching the difficult areas of medicine, especially anatomy, which is mainly a practical-oriented class, has created a lot of turmoil, and we were in a dilemma. From March 19, we have to continue our programs, and the programs has to be continued in such a way that there is no breakage of the schedule of the MBBS program, and the students have to be assessed at the time as per the academic calendar. And we had the real difficulties of teaching them, but the changes which we made was miraculous in the sense that the students, after their assessment exam, they also have to give us a teaching evaluation scale. And we see that it was 100% for most of my colleagues and myself. And that has really helped during this COVID-19. And that created a sense of attaining something which is very great, because to teach a group of medical students who is eagerly waiting to be introduced into new many things, and each day is a new learning for them, and to explain them sitting in the comfort of home and teaching them was the real most challenging thing which I had faced through COVID-19. Thank you.
Thank you, sir. Thank you for your wonderful answer. Now here, I would request our Honorable Principal, Sir, Professor Dr. B.D. Targan, to please join the interaction.
Thank you, Madam.
Good evening, Targan, sir.
On behalf of MGM fraternity, I welcome Dr. Shajan Koshy to this show. So, from the bottom of our heart, we are very much indebted to you for finding time for us and trying to get reunited with your school. So the first question is related to the news, which spoke about both the pandemic and the green shoots in economics. So how do you see, sir, the economy is getting back? We are looking at some figures which are better now, but how about the pandemic? Like if you see in US, the death rate is quite high. I was going through the news in IIT Chennai because it is shut down because of many cases. So how a person in general should take precautions in this pandemic?
As far as the economy is concerned, since they are slowly opening up, the economy seem to be improving. But when we see the pandemic as such, wherever there is a new cluster or whenever there is a new individual found with COVID-19 case, the suspects, then the spread of infection from that person to the people who had been contacted by that particular person, within a span of 14 days, you would have contacted many. And that's the cause of the spread of this infection, which is a very great thing. And so for those reasons, that's the reason all the face-to-face interactions has been stopped. And we stay at a distance, we maintain our proper hygiene, keep mask over the faces so that the secretions from the nose and the mouth will not be airborne and will be spreading. And so that is the way which we are trying to prevent. The providing of vaccination for COVID-19 seems to be a better thing. But as far as the results are concerned, we have to wait and see. But the disease is still spreading. Wherever there is an opportunity, many gets infected. And then, as far as Malaysia is concerned, they are all quarantined. And then that cluster is not allowed to interact with the rest of the people. So we see success in that rate, but when we see the sporadic cases here and there, which is creating another fear. If, for example, if you are staying in an apartment, if one of the person gets infected, and we don't know how many places he has tested or how many places he has spread, and then that creates a big phobia among the people, and the phobia itself is a cause of a great concern. People being quarantined for 14 days, 15 days, etc., they are mentally down. And so I think so the pandemic is still prevailing, but the best thing which can be controlled is this form of social interactions which are there, and maintaining proper hygiene, covering our faces with a mask. That's the most important, which I feel from my part. And washing of our hands wherever we go, try to be clean and hygienic, and keep ourselves at a distance from all the people. Let us not gather in groups. And that's the thing which I think is preventing in some countries from the disease being spreading to different parts. Thank you.
Thank you, sir. Coming to your illustrious career, sir. So you are one of the inspiration for many who could get into medical when you had very limited resources, and still in those days you had a focus and you got into the best of best colleges, and now you are there in Malaysia. So can you just throw some light how you could achieve this in your life?
The best part of my schooling was I had dedicated teachers to push me to the goal which I was there. Especially at this stage, I should remember my biology teacher, Madam Ratnama Madam. She was the most biggest influence for me in learning the entire areas of biology. And our examination was an essay type of question, and the problems which we had to do is that all the questions which are there in each papers has to be answered in a sequential form. In the first entrance, immediately after the 12th standard, when I went in, then somebody told me that's not necessary, it's just a rule. And I was also, no, that was my first experience. And then when I wrote the entrance and came back, I got the marks 5, 6, and 8 for only the first question which I have written. And that was a very big shock for me because of my 12th grade marks. And when I got for a pre-medical test entrance, the first mark sheet which I got, I cannot dream of it. The second time when I wrote, I was very conscious. And then I was probably the first male student to get into MBBS from MGM school at the time. And my teacher was the most happiest person. I think the dedication with my teachers have helped me in allowing me to write the entrance exam and giving me the confidence to write the entrance and get success. That was the biggest thing which I felt, and that has kept me till now. And I remember our principal, Reverend Father T.T. Thomas, who was a very disciplined person. And even the day before expiry, he came to my clinic when I was in the casualty medical officer. He used to come to me very often to get his blood pressure checked. And each time when he comes and meets me, he hugs me to see his student sitting there as a doctor. That was another inspirational thing which I got throughout my life. But for all this, my success is I maintained my discipline and punctuality, and that was very much in my part of my life. And that helped me a lot till now. And even now, when I am sitting as an administrator to teach the school medicine program, we have different types of students from different ethnicities. So what training which I had been given in the school, in the time of 12 years when I had been in medical school, in the school, MGM school, has really created, which I never expected that I will be a doctor when I was even in the 12th standard, because it was considered very big thing to attain through the pre-medical test entrance examination and get in. And the next time itself, when I got it, and when I see my name in the local newspaper as an admitted candidate, that was the joy the greatest joy which I had in my life. Thank you, sir.
That's great, sir. So, above all, your punctuality and discipline is helping you a lot, and we are glad to hear that the formative years in the school has really helped you. Your connections uh, with the teachers, Madam Ratnamma and Father T.T. Thomas, has helped you a lot. Sir, my next question is you are also a teacher apart from a doctor.
Yes.
So, how did this transition happen? Is it by chance or it's an accident?
Say, for a medical graduate to be a teacher in a medical school is a big thing. It's a really a tough change from the clinics to the medicine, sitting in an OPD, seeing patients and sending back. I was in the Dhamtari area, which is actually the area where tribals used to come for treatment. I was in the Dhamtari Christian Hospital for 3 years. My mentors there, the consultants there, really helped me in learning so many things which I could not learn during my 5 years of medicine school in Bhopal. But in Bhopal also, I had so many incidences. It's like the Bhopal gas tragedy when I was there, and I could see death hanging around people, and I could myself count so many dead bodies in the forensic sciences department. And these all things made me learn that there is much things to be learned in humanity other than treating the patients also. I was a person who was interested in emergency medicine because that's the place where the patient needs an immediate care. And if the immediate care is not given, the patient will die. There we don't look into the money, there we don't look into that. But the unfortunate part was that MD emergency medicine was not available. And as you see, we in India has to keep on writing entrance exam for each and everything. So as soon as I completed my MBBS 5 years, they brought the pre-PG entrance. And we were not getting much resources as is available now, like online textbooks or online available resources, etc. Myself and my wife used to sit by ourselves and sit and used to study and get through the entrance exam. And when the entrance exam results comes, it is like that we always are not at par many times to reach what we see as emergency medicine is not there for me. And then my next thought was I would look into something which is research oriented, and that made me. And I was always a person who liked human anatomy from the very first beginning of my MBBS career school itself. I was very fascinated by the subject. And the best part is when I went for the counseling after my entrance examination, I was looking for the chance to enter inside, and I said, I will take MS anatomy. The person who was sitting there as the chairman was asking me, why do you want to take anatomy as your first choice? You will be sitting in one corner of a medical college and you will be just teaching students in anatomy. But the thing is that changed my career a lot. I'm able to stand in front. I was a very much introvert type of personality. I don't used to talk much. I don't used to interact much. But changes in the medical school and changes in my attitude towards society brought me a lot. And now to sit as a program director, to manage the year 1 and year 2 for the students in a country not my own, I think so that's all a grace from God, as well as my passion for teaching. It's not only teaching, and my students have always kept my morale high in teaching, because every year I get my teaching evaluation, and my students always say, sir, I would like to listen to you again. And that is what even happens now during evening time when I sometimes relax. I get an immediate WhatsApp message, sometimes at 10 o'clock also. I respond back to my students because they are in a query and I have to answer it. And I think so that's my responsibility. And I have now my students reaching far off places, working as doctors. And whenever they interact with me, nowadays social media is a very important thing. And the way they have told me about keeps me my morale high as a teacher, and I feel that's the most rewarding job which I can get. And I still have my clinical interaction because my friends, my relatives, my people who know me come and ask me about my clinical interaction. My wife is a full-term clinician. My daughters are also going to be clinicians. in the same that my daughters are clinics. So I think so that we are not breaking that pattern. We are still clinicians, but at the same time, we all are teachers also, because I like to interact with the students and teach them more. And that has helped me a lot. So I feel so that what I'm doing is a grace from God, which I believe always, and that is bringing me up to this heights of experience. Thank you.
Thank you, sir. Before I hand over the rest of the proceedings to the anchor, my last question is, since you have rich experience of being a doctor and your family is totally a doctor family, your wife, your better half, your daughters, all are doctors. So a student of class 11 and 12, how he should foresee for his preparation in getting into this chosen profession of becoming a doctor?
I think for every student who is in the junior college, which we used to say 11th and 12th, I feel that the student should have a passion. And each day should have a particular aim. To complete that aim, we should work for that day. Maintaining our goals for a day and having a central goal at the end of a year, if we are attaining the goals each day and we finish our duties in the excellent form, in the form of punctuality, reading back what is needed, at the same time not getting stressed up. Not getting stressed up is a very important aspect of life. If you're stressed up, you will be making a lot of mistakes. Relaxation in between is needed, and the relaxation which I would say is get out of your books and table and just at least have a small walk and relax yourself and get back to the aim or the goal which you have prepared. The slow, steady running will always win the race. And you should have a clear aim and a goal, and a clear vision and a mission always helps in achieving what you are needing. And medical program is not so easy. There is ups and downs. You may sometimes see the results so horrible, even though you have studied, because there may be only, after studying a lot, there may be only few questions which comes for the exam, which sometimes you would not have tested. It has even happened to me. But the thing is that if you're regular and have read at least once, maybe you may be able to give the certain significant points which would help you in answering the question in the most correct way. And we as examiners, we look into what is necessary and needed from the question. And so that is how my students are also helped from my point of view. And that's the way I have also succeeded. And my teachers from the school has given me that way of identifying from the lessons what are the objectives. At that time, there was no objectives in our textbook, but it also always helped us. And they always encouraged us to write the correct answer to the question which is available. If you don't know the answer, I usually doesn't attempt, and it is a blank space. Thank you. Maybe my answer.
Thank you very much. Yes. We are very much thankful to you for finding time for us. I'll join in between now. I've taken most of the time. I'll hand over the proceedings to the anchor. Sorry for the excess.
Thank you.
Thank you, sir. Thank you so much, sir, for wonderfully sharing your experience of being a student, a doctor, and a teacher. So, here we have some of our students with their questions. And the first question will be from S. Suraj of class 10th I.
Hello, Suraj. Nice to meet you.
Good evening, sir.
Yes, good evening.
Sir, can I please have a permission to ask a question?
Yes, definitely.
Sir, my question is that why we are not able to overcome this novel coronavirus situation despite making rapid advancement in the field of science and technology?
So the coronavirus as such is not something like the normal bacteria or the viruses are there. The immunity part which is developing in the human beings is not so fast, because the virus modifies itself each and every moment in the genetic material, and it's an RNA virus. Once it enters the body from one person to other, so you can see there are different strains of COVID which is seen in different parts of the world, and these different strains needs different forms of study to bring about the proper vaccination. Now, we have seen that in European countries, the mortality rate is too much. And we see that in some parts like Vietnam, etc., the spread is very less. If we would have taken Malaysia, in the initial part, we had no spread of the disease at all. So even though science has advanced a lot, that doesn't seems an answer for many of the things which we are facing, and COVID-19 is one among them.
Thank you very much, sir, for a wonderful answer.
Thank you, Suraj. Thank you, sir. And
Thank
the
you.
next question will be from Sharon Susan Thomas of Class 12th Bio IP.
Hi, Sharon.
Good evening, sir.
Hi, Sharon.
So my question is, as it
Yes.
is said that a significant portion of medicine is learned by doing, not by reading. So can you please tell us how these online modules are affecting the clinical experience as well as future of medical students?
The online experience of teaching was my topic of discussion. When I will project my PowerPoint slides, maybe you will be able to see it more clearly. But the systems have changed a lot from the month of March till now. Throughout international universities, we also have conference with the universities of Australia, New Zealand, America, etc., where we discuss about how anatomy teaching, which is mainly practical oriented in the class, in the dissection of the human cadavers and learning from that, but which is not possible now. But at this stage of this development of science, as has been told, we have so many other softwares which is equivalent to what we used to do in the practical class. And that has been used as the main system of teaching during our lectures, practicals, and our discussions, and which helps the students to assimilate much more sitting at the comfort of home. But what we miss from the students is that their social interaction is gone. When they are in the classroom, the interaction with the teachers is there, interaction with their peer students are there, interaction with their seniors are there, which is a great hindrance. Otherwise, what we teach is almost equivalent to what we had been teaching before COVID also. And the resources available in this era is too many that you have no difficulty in assessing any of the applications. For example, even if you have the most phones that has Android, that has got complete anatomy. So anatomy is always there. On the go, you can learn anatomy. If you put in a Google search, you can find the normal physiology. If you put an image for a particular pathology, it is always there. And in the same way, all the resources that are available in YouTube also, where experts from different areas of the world are giving their classes. And that's how most of the students are able, and it is self-directed learning. We cannot teach entire aspect of medicine by the 5-year program. It is learned day by day. It is depending upon your passion of how much you can read, how much new things you are looking for. For example, research articles. We are also, when we teach, we introduce the new research articles which come. For example, now COVID-19 is a day-to-day basis of research and learning. So that's how we teach in medical school programs. Hope you are satisfied with my answer.
So may I ask you one more question, please?
Yes. Yes, please.
So during this pandemic period, is it safe to get care for other medical conditions?
Yes, definitely. You should have the care for other medical conditions, because when you see the mortality rate of the coronavirus, if you are having other conditions, if you neglect those, and if you are infected by the virus, that's the cause of death in many cases. And we have seen that those persons who have significant illnesses like diabetes, heart problems, or lung disease, chronic lung disease, etc., they are the person who, if he doesn't take care of their hygiene and their medicines properly, etc., these people who get infected with COVID would be the cause of mortality for them. Thank you. Anything else? Yes, you should take care of other conditions. You should take care of other conditions even though you have COVID-19. Maybe you can contact by phone the physician or the consultant which you are consulting to get the medicines the prescription of medicines or a change of schedule or change of dosages, etc., has to be done through the contact with your consultants. An online program, and nowadays online contact with your consultants can be done. And so that is the way you can have your proper medicines, take care of your controls, which is needed. Especially diabetes mellitus is a very common disease. And in the present generation, if it is not controlled properly, of course, you will have some other difficulties.
Thank you so much, sir.
Thank you.
Now we have our expert teacher, Mrs. Suja D. Varghese, to put forward her question.
Good evening, madam.
Very good evening, sir.
Good evening.
Myself, Mrs. Shajan Koshy.
Yes, please.
Sir, I would like to know about the general awareness among the people of Malaysia about this coronavirus. Are they all taking all precautionary measures seriously to prevent this disease, this virus? I mean?
Yes, that's a very important question. We see in Malaysia, the general public is always aware of it. So even when we travel, you can see that the cars does not have more than 4 people. If you go into shopping mall, it's still open, but the people maintain their distance. And as you enter the shopping malls, there is an area of where your temperature is checked. Your mask is there. If you don't have the mask, you are not allowed to enter the shopping malls. Even the hotels, restaurants, etc. There is we have a scanning machine which scans your temperature, and you have a barcode which you have to scan through your phone, which gives the entry into that place or restaurant. And that keeps a record of the number of people coming inside. And so as a result of which, the spread can be easily traced through the contacts. So the general awareness of the people is very good. But only problem is where the migrant workers are clustered together. They usually does not follow the principles. Sometimes they're not aware of it. Otherwise, the control of among the general population in Malaysia is extremely good.
Okay, thank you very much, sir. I'm very happy to hear that the people are so aware and they are following all precautions. Okay. Sir,
Yes.
May I ask one more question?
Yes, definitely.
Sir, does the climatic variations also affect the spread of coronavirus? In India, we see there are so much of variations in climate. So does this also
Yes.
affect the spread of this virus?
Yes, definitely. In the studies have told that in cold winters, the spread can be much more. The reason for this, which I see in that is, I am foreseeing is because during the COVID, during the winter season, people are more covered up so as to prevent the cold. And the hygienic issues are very a problem for many of them. That may be the cause of spread of COVID-19, which I think is the reasonable factor for the spread during the winter season. Here it is always raining. If you come into tropical climate, it is always raining. But still, the disease is under control. So we see that the winter, it is going to increase as has been told, and we have seen that in European countries also the spread was much faster, especially in Italy, etc. Maybe a factor of the climate change can cause the spread of disease. And WHO is also warning us to take control. But now we see the pandemic is declining, and we see the recovery rate is much faster compared with the infectivity rate. And as a result of which, we find that it is much less compared with what we have suspected. Still, the December month is still there, and the winter season is still on, so there is no definite answer for it. Maybe it can spread, but proper hygienic conditions usually will prevent.
Right, sir. Sir, all of us are waiting eagerly for this COVID-19 vaccine. So what assurance this medical field can give to the people about the safety of this vaccine?
I didn't get your question. Please repeat, please. COVID vaccine?
See, we are all waiting eagerly for the COVID-19 vaccine, no?
Yes,
So
yes.
what is the assurance of this medical field to be given to the people regarding the safety of this vaccine?
The tests has been conducted in different parts of the world with COVID-19 vaccine, and the results has been found to be good. But unfortunate incidences like allergic reactions have occurred in some parts of the world, and they are further checking it because there are allergic proteins which are used for the vaccination, and that may create allergic symptoms, which has resulted in many people suffering because of the COVID-19 vaccine, where the trials has been done, but not the numbers are not many. But COVID-19 vaccine seems to be a very comfortable way of controlling the spread of the disease. I think so. We should take it all positively. It depends upon the preparation of the vaccine. Maybe the person who is allergic to some components of the vaccine will develop allergic reaction, as is seen in Peru, which is recently found, and they have stopped the vaccination trial there. Some places we have found that they have demyelinated the nervous system, as a result of which paralysis, etc., has seen, and that may be because of the various materials which are used to prepare the vaccine. But it is not that many as we have seen. But vaccine seems to be a very important way of controlling the spread of this pandemic. Even if it is, they say that it's completely eradicated, I don't think so. It is not eradicated until and unless a proper vaccine is introduced throughout the world and everyone is vaccinated, because the disease is in the population. It is spreading whenever it gets a chance.
Thank you very much, sir. Thank you for answering my queries. Thank you, sir.
Thank you, ma'am.
Sir,
Thank you, sir.
Yes.
excuse me, sir, do you have a presentation, right?
Yeah, I have just a PowerPoint presentation. If the time is there, then I will present. Otherwise, it's okay. If you have questions and answers, I can keep on answering questions and answers. That's all. Otherwise, that's okay. Because more people are interested in knowing what is happening, especially at this time.
Yeah, briefly, if you can make your presentation. And Jitin, are we ready? Can we?
Ma'am, yes, sir. Yes, sir. We are ready, sir.
Okay, then I will just do a share of the screen and then we can present. Thank you. Hope you all can see my screen.
Not
yes.
Yet.
Can you?
No, sir.
Okay, sorry. Can you now?
No, there's some technical issue. Jitin, do you have the presentation with you?
Yes, now it's okay. Is it clear?
Yeah, now it's okay.
Okay, thank you. So I will just go through what I have to share. I'm telling about teaching in the medical school in the COVID era, the challenges which we face. This is the university where I work, and this is our beautiful lakeside campus, which we say, and you can see a wonderful lake in front of it. This is the campus where I teach. I will mainly concentrate on the anatomy, which is a very important subject which is taught in the initial part of the medicine program. So this is about anatomy dissection hall. This is the normal routine which we had in the year 1 and year 2, where we as lecturers would demonstrate the human cadaver, dissect that specimens, and then we go into the cadaver dissection where they cluster around cadavers and we teach them by dissecting the different parts of the human body. This is the museum, which is also now not accessible. This is where all the specimens are there, and the students are able to interact with these specimens, and they are able to learn when and wherever they wish during the free time. We also had something called clinical skills suite, because in year 1 and year 2, the students are not exposed to the real patients, but these patients are simulated. These are actually fabricated like human beings with all the necessary parameters like the respiratory system, cardiovascular system, etc. And the students are learning from this. This is also prohibited now. This is the norm, the simulated hospital ward which is shown here, and there are trainers which train these clinical skills which they have to go through during year 3, 4, and 5 in the hospital. When came COVID era, our modes of teaching still keep on continuing as lectures, practical seminars, tutorials, and problem-based learning and clinical skills training. This is a picture or a still picture from the screen which I have taken from our practical class. You can see that there are 2 people of us lecturers in the practical class, and we have the access for few students. If there is a 35 or 50 number of students, we are allowing 5 students or 10 students to come in. We will be demonstrating the practical at the same time, but it will be online for all the other students sitting at the comfort of their home. And this is how a practical anatomy dissection is being conducted. This is the case when we give a problem to the student and we sit with the students discussing about a clinical case, and the students learn from the different sites and they present, and that is known as problem-based learning. This is how they interact with each other by sharing their screen, and the questions which they have, they discuss, they make it a tabular column, and thus they learn. This is the practical class which I have shown you in the initial part, where we are conducting the practical class, and the few students which are available in the class, the rest of them all online, and their attendance is very regularly monitored by the number of participants in the practical class. We have quiz competition, which is the most common thing which is already done in schools using Kahoot and all. Then we have something called case consultation, which is in equivalent with the patient discussion in the ward. We make up a case and we are consultants sitting. Here is the microbiologist, the pathologist, the pharmacologist, and all the different clinical teachers, and we sit with a case and make up a case, and then the students are given this case through what is known as Socrative, and they undergo this online case discussion, and this helps them learning about a real patient case sitting at home with all the symptoms and signs, the investigations done, the answers given, and finally coming into a conclusion of diagnosis. So this is how what we do in very short to explain you about the online teaching, what we do, and thank you for all for the listening.
Wonderful presentation, sir. Thank you very much. It was very informative. Yes, Madam Mashmi.
Thank you, sir. Thank you for this wonderful presentation. We have learned a lot of things from this presentation.
The time limit is there, so I cannot go into explaining all the continuing with the assessments at the right time, and so there is no breakage or change in the schedule programs. And as my program director, I have to manage with all the other faculties to maintain all this coordination, and so it was a tough time for me in initial part, but all with all this, and they all have learned during this time, and they are all helping me. And so as I told, we have a teaching evaluation scale, and we all have got 100% from our students, much better than what we did face to face. Thanks, Dr. Paragal. Any more questions?
Yes, Madam Mushmi, please.
Moving ahead to our next part of this program, which is an interesting and fun part. Sir, we have a rapid fire session in our program where I will be asking a set of 5 questions to you, and you'll be given only 10 seconds of time to answer each. So shall we start, sir?
Yes. Maybe my answers may be not appropriate at the time. Okay, thank you.
Doesn't matter. Okay. So the first question that I have, sir, is how would you use 3 words to define yourself?
3 words. Faith. 3 words. 3 words should be there: faith, discipline, punctuality.
Okay, sir. Very good. So my next question is, As per you, medical science is equivalent to dash. You have to fill in this dash or blank space.
Trust.
Okay.
Every person, every patient who comes to a particular doctor, if he is trusting that doctor in the treatment, and then there is a cure for it.
Definitely, sir. Wonderful answer. Third question. What's that one thing that each medical aspirant should follow? What is that one thing that each medical aspirant should follow?
Should have a vision and a mission in front of
Yeah,
the
vision
mission
and
should be
mission.
there always. That mission always.
Vision and okay, sir. Okay. And fourth question is, how would you explain the role of MGM in your
So vision is my answer.
Okay, sir. The next question, how would you explain the role of MGM in your achievement?
See, when I was in MGM, there was always around the bus in the front of the school, there was a logo. What is it? Thomas Soma Jyotirgamaya. That means which we always
Okay, we are very glad that
have the meaning in which what we always follow that statement.
Okay, I think we have some real connectivity issue from our guest end. Sir, is it okay now? Am I audible? There are some connectivity issue.
Yes, now I am able to. Yes. The answer. Can you hear now?
Yeah, there is little breakage. So one last question which has come from one of our teachers is the role of artificial intelligence in medical science, especially the AI robots.
Yes. I am not the right person to answer this question, but it is actually helping us a lot because artificial intelligence is able to find out and point out the diseases, diagnosis, and then it is also telling about the different modes of treatment. And so a person sitting in here can consult with the consultant in UK or US or the chief physician, etc., through means of artificial lot. So as well as doctors, as well as different form of people collaborate together, and a lot of research is being conducted now. Hopefully for the next coming years, we will get so many positive results of artificial intelligence. And that would be a pioneering issue in medical field.
Okay, to sum it up, before I hand over to Madam Moshmi, on behalf of MGM fraternity, the management, and the whole school, parents, students, and teachers, I thank you for sparing your valuable time for us. The session was very informative for us, sir, especially the question answer round, and of course about the university you are teaching. So we hope that you are able to interact with your students one-to-one pretty soon. With all best wishes, thank you very much, sir. So I formally ask Madam Anchor to take over now.
Thank you, Prof. Tarakan.
Thank you so much for sparing your time and giving so much good information and your wonderful answers, of course. Thank you so much for your valuable contribution, sir.
Thank you.
Live
Thank you all for inviting me. Yes. Thank you. So,
as
can I
if
leave?
you were to die tomorrow. Learn as if you were to live forever. This is a beautiful quote given by Mahatma Gandhi, and we must always follow the same. So, with this, we come to an end of this program with a very positive and informative note. And stay tuned for our upcoming events. Till then, stay safe, stay healthy, and goodbye.